well, we'll go ahead and get started. I know other people are coming, so we'll see them. But, I don't want to hold you all up. So today what we're going to do is talk about the assessment report, and we'll do a little more about interviewing. And then either today or Wednesday, we will have you start interviewing your partner. It might be challenging to set attendance, but we will get there. So I'm going to start with the actual template, which I realized after I looked at it that needs some tweaking. So I will be sure to do that to make sure it accurately represents. Make sure that it accurately represents the assessments you did this semester, because I changed a couple of them up. So you are going to do an intake interview with your partner, probably Wednesday. And so all this information will come right from there. You're going to do the SKID as well. That's a structured interview. And then we have the self-assessment tasks you did. So you'll write about each of those. Here's where I need to change it up because I know that we did different ones of these because these were charging. So I will make sure I get that. You'll write about the R bands. You'll write about the GRE. You'll give some summaries and conclusions and some recommendations. So basically for each thing, you're just going to write the results that your partner had from talking through everything with them and doing the test together. And then making sure I'm checking off everybody who just got here. And then some of these you get to expand on more, right? So something like the summary and conclusions. I mean, if your person is perfectly normal on everything, your summary and conclusions are, this person doesn't require any additional treatment, they're great, they're good to go, right? If your person is struggling in a certain area, you might recommend something like working with the LRC or going for therapy or any number of things, okay? This is pretty plug and chug. This seems intimidating, but essentially you just kind of put the scores and a brief interpretation for each of these. Like I said, I will update this and make it accurately reflect what you have been doing this semester. Alrighty, so we have a brief chapter outline, PowerPoint, whatever, talking about the assessment report. So we'll go over this before we have you actually work on the interviews. Everything's going to appear. Because once upon a time, I thought that was a good way to do it. So the purpose of the assessment report, why do we spend all this time and energy writing up this big, long thing? Well, this is the deliverable or the end product of the assessment process. These reports are used in a lot of different ways. They might be just responding to the referral question that's being asked. And that could be, we think this kiddo has ADHD. That could be, this person seems like they're really struggling with mood, right? Things along those lines. It could be, assess this person to see whether they're competent to stand trial, right? All those count as well. Oftentimes, they provide insight to therapists and clients working together in therapy. As part of that, they can assist in the case conceptualization process. So case conceptualization is where you take the diagnosis and you kind of reflect on it with things going on in that person's life, and you come up with a treatment plan. So that goes with the next one, which is to develop treatment options and counseling. So are we going to refer this person for medication? Would that be something that'd be smart to do? Are we going to recommend a certain type of therapy, right? Might be used to suggest certain educational services for students with special needs. So those with developmental delays, learning differences, or even those who might be advanced, right? This kid's gonna get really bored if we just keep them at the same level doing the same work. So maybe we need to think about ways we can enhance it for them. It can also work to offer direction when providing rehab services. So maybe this is vocational rehabilitation services, things along those lines. To offer insight about treatment options for people who might have some sort of cognitive impairment. So someone who has a brain injury, someone who's struggling with dementia, how are we going to recommend tasks or ideas or treatments to help improve this person's quality of life? May be assisting the courts, as I just mentioned, in making difficult decisions like custody decisions, not guilty by reason of insanity, things like competence to stand trial. To provide evidence for placements into school and jobs, right? So things like the GRE, the SAT. There are certain jobs like the police department or the fire department where you might be conditionally hired and then have to undergo a psychological evaluation because, again, we don't want someone with certain disorders, right? Having that power or, running into fires, right? And then to challenge decisions made by institutions and agencies. So maybe we are saying this person was denied disability and that's wrong, right? And this assessment can prove it. At the VA, we often sometimes work with our patients to get decisions reversed. Here's the lovely thing at the VA, and this happened very clearly because we had an Army base just across town from the Augusta VA. And so they would get a psychological and a physical assessment when they were discharged from the military. They would get a psychological and physical workup, often the exact same thing when they started at the VA, just for treatment. And somewhere in between those two, they'd also get the same workup, but to determine their service connection, which is the fancy VA way of saying disability. So if you're service connected for certain things, it means your treatment for those are free and other things along those lines. So sometimes, especially again, since we had the base right across town from us, sometimes they were going through those 3 assessments within weeks or months of each other.
Are you talking about like PTSD?
Yeah, it could be PTSD. It's all the physical things. I had a guy who was service connected for schizophrenia because he had a psychotic break while he was in the Army. So yeah, all kinds of things like that. But yeah, PTSD is a great example. My supervisor had a client who had PTSD because of military sexual trauma, but it was so it had happened so long before that no one even sort of knew what that term was. And so they had to just fight and fight and fight to give her that recognition. Essentially.
Yeah, at the place that I'm on, military every once in a while. Actually, now it's almost like every week. We're saying that's called a ED, I forgot what it's called, but it says who's going to come see you and how many visits the
right.
given them, and
Yeah, and that's very similar to private insurance. They'll kind of do the same thing and say this is how many visits we're going to allow, and then you can, as the provider, try to petition for more for them, for example.
Yeah, it's all an assessment.
Right, exactly. Yep. Yep. So these are really valuable, right? Really important, and they can make or break a person's life, right? So it's really important that as psychologists who do these assessments, we act with all those ethical principles we talked way at the beginning of the semester, right? All right. This is a great term that your book author used, and also my assessment professors in grad school like to use, garbage in, garbage out. So if you gather garbage information or don't do your job and get full information, your report is really limited by that. Your report's only as good as the information you gather, right? So how you gather that information is as important as writing the report itself. So in gathering that information, you want to take into account the breadth and the depth of your assessment. The breadth here is thinking about casting a wide enough net, right? If we get someone who, like, the referral question is mood problems, right? And we're only like assessing them for depression, maybe we miss that they have bipolar disorder. Maybe we miss they also have anxiety. Maybe we miss they're actually having PTSD issues, right? So you need to make sure we cast that wide enough net. And then depth is assuring that you're using techniques that reflect the intensity of the issues being examined. So if I think someone has schizophrenia, I shouldn't just do a screener for that, right? I should do a whole assessment related to that so I can get as much detail as I think. Just like for PTSD, right? I can do a quick screener for that, and I could even do like the module from the skid for that. But if I'm thinking this person has PTSD, I probably want to do one of those PTSD specific assessments, like the clinician assessment of PTSD symptoms, the CAPS. So that's really important that you gather the information that's going to help you make those decisions. All right, so we've talked about these in passing before, but I think, especially since y'all are going to do them with each other, this is helpful to kind of refresh on what these are. So structured, unstructured, and semi-structured interviews. Interview is the most important thing you do in all your assessments. Every single client you do an assessment on, you should have some sort of interview with. It sets the tone. It lets you establish professionalism. It helps the client to understand why you're doing what you're doing. It allows the client to become desensitized to intimate and personal information. Sort of realizing, like, you're going to share very different information than you might in like a job interview, for example, right? And that's okay, and that's confidential, and that's kept in this room. Allows the examiner to assess nonverbals and to determine what might be important to focus on, right? And these can be really obvious as, like, you know, sort of like jittering because they're anxious. Or it can be something like whenever you bring up a certain topic, they avoid it, right? Maybe you don't push them on it in the interview, but you say to yourself, that's something I want to circle back around to. It allows the examiner to learn firsthand the problem areas of the client and to place them in perspective, and to hear from the client their perspective, right? And that's often different than the person who made the referral, right? Because they have this subjective experience of living in it. And it gives the client and the examiner the opportunity to see if they can work together. Sometimes you get fired by a client after the intake, and that's okay. You have to, like, learn to roll with it. Sometimes you're just not a good fit. So the structured interview, the example is that structured clinical interview for the BSM, which you will, again, start either today or Wednesday to give to each other. This offers broad enough areas of content to cover topics a practitioner might otherwise have missed or forgotten to ask. So it certainly assures that breadth of coverage. It increases the reliability of your results by ensuring that all prescribed items will be covered. These are often very well normed and have really good psychometrics, great reliability and validity. It ensures the examiner will cover all the items because they're listed in detail, and there's an expectation you'll cover them. And ensures items will not be missed due to interviewer or interviewee embarrassment, right? Maybe there's something you never would ask, right? But it's really important to that person. There are some drawbacks to any of these techniques. the examiner might miss information because the items are predetermined and you don't feel as free to go off a tangent or a hunch, right? So it's good to combine a structured interview with an unstructured, for example. Clients can experience the interview as dehumanizing. So to kind of try to offset this, the way I would do it in our training clinic is we always did our unstructured interview first. And then when we move to the skit, I would tell them, okay, now I'm going to ask you questions in a very specific way. It's going to feel a little robotic and weird compared to what we've been doing, but bear with me because this really helps us. And if you can get client buy-in on that, then it's really great. Clients, particularly those who are from minoritized voices, may misinterpret or be unfamiliar with certain terms, particularly let's say they're a non-native English speaker. Follow up by the examiner to alleviate any confusion on the part of the examinee is less likely compared to the other types of interviewing. And it doesn't always allow for depth because the interviewer is concerned with gathering the information rather than delving into detail in a particularly important or sensitive issue. So unstructured interviews are important to include. These are very open-ended questions, and you can kind of just go on tangents, essentially. Typically, the first question I would ask people, and I believe this is the first question on the sheet I'm going to give you all. Yep, tell me about what brought you in today. Really open-ended, lets them go any direction they want, right? And you get a lot of information from that. So you're going to build rapport. It allows the client to feel like they're directing the interview, allowing the client to discuss items that they deem important. It offers the potential for greater depth of information because the clinician can focus on particularly sensitive areas and uncover underlying issues that the client might otherwise avoid revealing. There are some drawbacks, though, because it doesn't allow for full breadth of coverage. The interviewer might miss information because they're caught up in the client's story instead of making sure they cover every aspect. The interviewer may end up spending more time on some issues or items than they might like because the client goes off on that. So that tell me what brought you in today often was just a sentence or two. But I had a client I saw with narcissistic personality disorder, and that was 45 minutes. Right? It was like backs of sheets of paper, and none of it was necessarily that relevant. It certainly, like, behaviorally was really informative, right? But, okay, we're using time that maybe isn't that helpful. So you can also do what's called a semi-structured interview, and that has the advantages and drawbacks of both. And that's really what, when you do your intake interview with your partner, you're going to be doing. So we had this intake interview cheat sheet that we used in our clinic when we did intake interviews, and you have an abridged version of that, essentially. And so it is a set of questions, but you're much more flexible in terms of follow-up and things like that. You can also do computer-driven assessment now, and this has become very sophisticated and as reliable as structured interviews. They ask clients to divulge detailed information like presenting problems, legal issues, current living situation, tentative diagnosis, emotional state, treatment recommendations, mental status, health and habits, disposition, behaviors, and physical description. And then it will actually spit out reports for you, and you can just cut and paste some of that into your report. Obviously, the examiner is still responsible for the end product report, and so you want to make sure that that's accurate and that the people who created the program don't have some typos in there. That happens. So how do you decide what instrument you're going to give people? Well, you want to think about the purpose of the assessment and both the breadth and depth needed to do adequate assessment. And then you want to choose from all the kinds of assessment instruments. So why is this person coming to me? Well, they're saying they have PTSD, but they're also saying they suffered a mild TBI, or mild traumatic brain injury, while they were in country. And so they're also having memory problems. Okay, so in this case, I probably want to do that CAPS with them. And I probably also want to do something like the ARGAN, right? Start testing out how their memory is doing. And it's important to only use instruments that are important for the purpose of your assessments. You can't just throw stuff at the person because you think it might be fun, right? You're practicing unethically if you do that. The other part of this, using instruments that are appropriate, is making sure they are normed for that person's age, for example. So like you wouldn't give an adult the whipsy, right? So that's for preschoolers. And so again, the person who wrote your text is a counselor, so that's why this is first, because we also have stuff about psychologists here. So counselors are responsible for the appropriate application, so scoring, interpretation, and use of assessment instruments relevant to the needs of the client. And you can see that's from the American Counseling Association Code of Ethics. And then from the American Psychological Association Code of Ethics, we have something very similar. That psychologists administer, adapt, score, interpret, or use assessment techniques, interviews, tests, or instruments in a manner and for purposes that are appropriate in light of the research on or evidence of the useful or proper application of those techniques. So this means if you're someone who does assessment for a living, it's your job to keep up with the assessments, right? So like the training I did last November with my grad school professor Yossi on the MMPI 3. I did that just because I wanted to be able to teach you all about it. I probably could have just like read about it, but I was like, I really want to know about it. If I were practicing, I would ethically be required to go to something like that so that I knew how to use that correctly. I understood the psychometrics, I understood the changes. So in terms of writing the reports, clients do generally have access to their records. So that's something to keep in mind, particularly under HIPAA and FERPA. People have the ability to access their reports. And so you want to make sure you should do this anyway, right? But it's a nice reminder to write as if the client's going to read it. Yeah. Yeah. So technically, if many of you had assessments when you were kids, and your grade school still has the records, you should be able to request them under FERPA. And same thing as like, if you saw a doctor, 10 years ago for something, you should be able to go request that. And the way that a lot of doctors are handling this now is just having the patient portals, right? Because then you can access it yourself once you get your login information. And it's really interesting. So when I was on my internship, I dealt with two different patient portals. There was the VA system and then the medical hospital we worked with. And it was interesting how both were handling psychological information very similarly. That the only people that could access your psychological records were your therapist and your PCP. But like all your other records, literally anyone who logged on in the system could see, because maybe you come to the ER, right? And they need to see that. So there's actually like this extra layer of protection for that, which I think is really great. But yeah, so you should be able to request these things. And this is why, for example, you can request your like transcripts years afterwards, because it's pretty. I mean, like it was a little ridiculous that when I was applying for these jobs, I had to provide my undergrad transcript. Like, I guess they just want to see you have your degree, but like, I didn't make it up, right? I mean, grad school made sense, so that was right before I came here, right? But yeah, a lot of jobs will request those things. The Freedom of Information Act is another thing here. So let's say your report is part of a court record. Typically, those are just open access to the public unless they're sealed for some reason. But under the Freedom of Information Act, you or a reporter or anybody can at least petition to get access to those. Tell you a quick, not so fun story about that. So when I was in college, I worked on our paper. Our paper was a weekly, entirely student run. And we heard that over holiday break, a professor had been escorted off campus by not like security, but like the sheriff. We were in rural Ohio, so that was like our police. And so through the Freedom of Information Act, and actually Ohio had its own state one called the Sunshine Law, we got the report as to why this happened. And it turned out this professor was accused of sexually assaulting a student. And like, here you have a bunch of college students with this information. We had no idea what to do. We felt ethically obligated to report it, but we also wanted to protect the survivor, right? Especially since we were about the same size as Wesleyan, right? So if you publish certain details, people will figure it out pretty quickly. So we consulted with like the National Journalism Ethics Board, and got a lot of advice and input, and wrote an article that we thought was really well put together and ethical. But it was scary in the moment. But yeah, so like there's all kinds of stuff you can find out this way, even if you don't need to, right? So, and then HIPAA, just quick thing about, especially during COVID, there's been a lot of misconceptions about this. HIPAA does not mean your employer can't request your vaccine status, for example. What HIPAA means is if your employer called your doctor without getting permission, some sort of release from you, or your doctor didn't have a release from you, and your doctor told them your vaccination status without a release, then your doctor can get in trouble. So HIPAA really applies to medical providers, and psychologists are considered under that as well. So that's important to know. Because I know this, and during the beginning of the pandemic, I was like, this is a HIPAA violation. And then I was like, no, it's not. If you're voluntarily giving the information, it's not a HIPAA violation. All right, so when you write the report, you want to follow these guidelines. Don't use passive verbs. This person did this. Now just say things really clearly. Okay? Be non-judgmental. So try not to show bias one way or the other. Just present the data. Reduce the use of jargon. So think about who's going to read this, right? In the vast majority of cases, it will be maybe another doctor, maybe the patient themselves. You're sending it for a court case, it'll be the judge or other officiant, right? They haven't gone and gotten a Ptsd in science. They don't know our jargon, right? So you want to explain it in very clear ways as possible. Don't be patronizing. Subheadings are your best friend. That's why you'll saw when we looked through the template, there's subheadings galore, but it just makes it easy to follow. Don't use acronyms. Spell everything out. It makes it longer, but it's worth it. Kind of along those lines, you don't need to use giant SAT words, right? If another word will do the purpose. Again, the shorter rather than longer words. Make sure the paragraphs are concise and flow well. And then this last point is something people often forget. So think about the strengths of that person. We tend to focus a lot on the weaknesses, but what are they good at? And in fact, my favorite type of therapy that I was trained the most in, cognitive behavioral therapy, since I learned it in grad school, has focused on a strengths-based approach. And so rather than focusing on the problems, and obviously they're still going to address those every week, but when the person comes in every week, they ask about their successes that week. It puts them in a totally different frame of mind, helps them see that this is something they can change, they can accomplish, right? So that's really important. And let's say, particularly if you're going to be working with a person in therapy, right, you want to know what you can draw from, what will help you, what will get this person to enact change. Yeah, you don't need to be like, I'm the most brilliant person ever. Just write it, right? Describe behaviors when possible, right? So, you're writing a report about a kid with ADHD. You can talk about how, like, every 5 minutes they got up and just like wandered around the room when you were trying to test them, something like that, right? Only label when it's necessary or valuable. So if you're working with insurance, then you need to put a label on it, right? In order to get that client to have coverage and not have to pay out of pocket. That's for the client's benefit, right? There are some cases where you're not allowed to do this. So let's say you are doing something for a court. The vast majority of court systems, depending on municipality, but do not allow you as a psychologist to write anything about what they call the ultimate issue. Let's say you're doing a report on not guilty by reason of insanity. You can't write, this person is not guilty by reason of insanity, because that's for the judge or jury to decide. You can put all the information that suggests that, right? But then they are responsible for making those decisions. Write the report so that a non-mental health professional can understand. So then think about if it's for a kid, their teacher, parent, things along those lines. And don't be afraid to take a stand if you feel strongly that the information warrants it. So if you think this person is in danger of self-harm, or harming others, you need to be really clear about that. In fact, typically you would try to address that even before the report was written, right? All right, so typically reports will include all this information. Demographics are basic information about the person themselves, presenting problem or reason you were asked to write this report, family background, if they have a mental health history, if they have a history of substance abuse in particular, vocational and educational history, other important things. Mental status is like how with it are they at the time of the interview. Those assessment or test results, a diagnosis if appropriate, summary and conclusions, and then recommendations. And I think even the best clinicians, if they don't have a set template, sometimes forget that. And that's like the most important part in some ways, right? So democratic info, you want your information, the client's information. There are other things you might want to add depending on the type of report you're doing, right? Do we need to talk about this person's sexuality? Is that a part of why they're coming in? Do we need to talk about, what their status is in a court situation? Are they currently imprisoned? Things like those. And then you have the client statement and description, the history of whatever problem they're coming in, and then related factors, I'm feeling really depressed, but I just got a cancer diagnosis and my parents are going through a divorce, right? Like, that's really important to know. So family background, we want to look at what happened in their upbringing that may influence these things. We might want to think about where they grew up. Do they have siblings? Did they come from an intact family, a divorced family, a family where one parent was never part of anything? Were they going through the foster care system? Who were their caretakers? Who were other people who may have impacted on their life? And this could be positively or negatively. Maybe you live with your parents, but you have really awesome grandparents who take care of you after school every day, right? And they help shape you. Or unfortunately, maybe you have someone else outside your household who is a family member who abuses you, right? Important stories from childhood that might affect the person. And then, these things for adults, that some of which kind of go into demographic information. So we want to think about their educational background, their job path, if they have a job, right? Where have they struggled with getting a job? Again, legal concerns, sexuality, financial problems, other things that are going on in their life right now that are going to influence this are really important to think about. sometimes we kind of get bogged down in the idea that, like, oh, it's just something going on with that person and we can fix it, right? But sometimes we have to fully acknowledge systemic issues for that person, right, and work within those. So you have a 1 or 2 paragraph statement about mental status. You talk about their appearance and behavior. So were they able to focus during the interview? Did they seem to be keeping up with basic hygiene, right? Sometimes you have people who come in that's like, clearly haven't showered in several days and they're coming in with depression. That's really important to note because that helps you determine the severity, right? Speech patterns and content. Were they able to answer in coherent ways? And then their emotional state, right? Were they tearful throughout the interview, right? Things like that are really important to note. So offer the results of the assessment procedures. You wouldn't give out raw scores. Instead, for example, let's say we're doing IQ, you would give out like their IQ score, right? Rather than their raw scores on each little test. Remember that a whole host of people could get this test and read it. So you want to state the results in understandable, unbiased language. You want to be concise, yet cover everything relevant. And then present your results as objectively as possible. So interpretation should be kept to a minimum. You can interpret the findings based on the research, but you shouldn't be like, well, this means this about this person if you don't have any other evidence to back that up. Like, whoa, they scored this on the Rorschach, so clearly they have issues with their mom. And like, they didn't say that anywhere in the interview. They actually said they have a great relationship with their mom. Don't do that. And then again, probably the most important part that I think sometimes gets forgotten is the summary and conclusion. So this is your chance to pull together all the information you've gathered. And this is sometimes the only section of the report read by others. Give you an example. When I was in my 4th year of grad school for my placement, I did pre-surgical evaluation for people seeking bariatric surgery. And we had to fax our reports over to the surgeon's office, and they were literally like a page from that. And the front desk person would just highlight the conclusion and like maybe something from the body of the report, and that's all the surgeon would read. And like some of that is because they were super busy, and some of that is priority, right? Like one of the 2 surgeons just did not care about mental health issues unless it got in the way of him doing the surgery. The other one did, and would like read our whole report and whatnot, right? But just sort of know that a lot of people might just sort of skip down to this part. So make this really important. To make sure it's accurate, make sure you're getting all your main points in here. Try to be succinct and relevant. Again, sometimes I had very short examples here. Do not add new information. If there's new information, make sure it has a subsection above. Any inferences you make should be logical, sound, defendable, based on what's in the report, and with that, based on previous research in this area. And then again, I mentioned talking about strengths being really important. Woo! Dramatic slide change. There we go. So the recommendations is that last section, and it should be based on the information gathered. And sometimes this is like bullet points. Like when we did our neuropsychological reports, we would have like, here are 4 things you can do right now to start addressing your ADHD. Create this quiet study space, and you should go to, at Ptsd it was called student accessibility services instead of student disability services, and get accommodations. And we would, if they agreed, just send a copy of our report over to them, for example. It should be based on your information. It should make sense to the reader and to you, honestly. Again, some will do bullet points. I really like that just because it's easy for people to process. Some people just write a paragraph. And then you typically have the examiner's signature, and if the examiner is a student, then you would also have their supervisor's signature as well. And so then there's a couple things in your book that are really helpful resources for this. Alrighty, so you have about 10 minutes left. So if your partner is here, we recommend maybe starting to work on either the intake or the skid, and then we'll use Wednesday in class to keep doing that. So up here at the front, I have the intake, I have the skid, and then if anyone wants a hard copy of exam 4, I have that as well. And I have more of those coming up the printer. I ran out of paper. So if anyone else wants one. So come on up and grab what you need. And then if your partner's not here, you can either use this time to do whatever you need to do or head out. Yeah, that's fine.
But that should actually, I have her also do this to me or is it?
No.
Okay.
When is exam 4?
Whenever we would have taken it in class that day at
When did you open it up?
before Thanksgiving.
Before Thanksgiving?
Holiday. Yeah, so in theory Friday, but if you need to do only the weekend.
Oh, no, I can definitely not there. I didn't know it was open there. Oh, we are open.
People want more copies of the exam, like I said, I have some more.